Hello, and thank you for joining us today. My name is Marilyn Cook, Marketing Manager for Professional Insurance Programs, a division of WDA ISC, and with me is our Benefits Division Team Lead, Christine Nadolski. Chris has been with our agency for over 17 years, helping WDA members with their health insurance and employee benefits. Today, she will be discussing the WDA Association Group Health Plan and all that it has to offer. Before I hand this off to Chris, I would like to go over one item. Throughout this presentation, feel free to submit questions in the question area of the control panel, and we'll take time to answer all of your questions. And on that note, let's begin.
Good morning. Thank you for joining us today. Like Marilyn said, I'm Christine Nadolski from PIP, and I'm here to go over the Association Group Health Plan with you. So today's agenda, we're going to actually overview the plans and some plan types, I should say, and some common terms. We're also going to look at the specific plan designs, benefits of the plans, the many value adds that come with the Association Group Health at no additional cost, and how to proceed with the quoting process. So let's begin. We have two different types within the Association Group Health. We have first the copay plan, which is more of a traditional plan. It does have a predetermined rate that you pay for health services such as your primary care, your specialists, and your prescription drugs, as well as urgent care. These plans do tend to have a slightly higher premium than its counterpart, the high deductible health plan, or a lot of times we refer to them as the HDHP. In a sense, these plans are actually HSA eligible. They do have a high deductible that you must meet before the insurance will start paying its share for the office visits, lab tests, and prescriptions. The premium costs do vary, but again, the HDHP, and I'll certainly refer to these plans as HDHP throughout the presentation, they tend to be more cost efficient. You do have some tax benefits with these when you are establishing that HSA or health savings account plan as well. I do want to mention that with both of these plans, and I'll touch on this later in the presentation, preventative care is going to be covered at 100% if you're in network. Now, we have two different types of networks with the association. We have WPS Health Insurance, which is the statewide network, which is the broader of the two. That encompasses about 98% of our providers within the state. And then also WPS Health Plan, which is a narrower network and thus will save a little bit of money on the front end with the premiums. The WPS Health Plan works with a select network and really encompasses a lot of the Aurora, Bellin providers rather than the Froedtert and those type of networks. So, but if you want, we will definitely send the tip sheets when you request information so you can see what providers are in what network. Some of the terms that you may need to know or know already are deductible and co-insurance. Your deductible really is how much you pay for your health insurance before your health insurance actually starts to cover a larger portion of your bills. Always a key reminder that deductibles do reset every year. So January 1st, that deductible is going to reset regardless of when your renewal is. So you may establish a group plan, let's say April. So your group renewal will always be April 1st of the next year, but your deductible will reset January 1st. Another term that we want to point out is co-insurance. And this is actually a percentage of the medical charge that you pay, with the rest being paid to your health insurance plan. It's almost like a cost sharing purpose. So a lot of our plans are either 20% or zero co-insurance. Sometimes they're listed out as 80% or 100%. What this basically means is that any charges that go to your co-insurance will be covered at 80% by the carrier, and you are responsible for that 20%. Again, it's that cost sharing between you and the insurance carrier, and the lower the co-insurance is, the less the premium will be. So let's take a look and see what else we have for you. The plan designs. The Association Group Health Insurance actually has 9 different plan designs. We have 4 copay plans, and these are the traditional type plans that you might be used to. You have a set deductible. You go, as you can see at the bottom, primary care provider is $25. Your specialist is $50. Urgent care is a copay as well. And it normally does include the prescription drug plan, where you have your generic brand name preferred at different deductible or different copay levels. The other 5, and we actually recently added a $7,500 deductible, is the HSA qualified high deductible health plans, or the HDHP plans. Now, they start at a $2,500 deductible, and this is, they have 100% co-insurance or 20% co-insurance to help maintain some of the premium. And again, it goes up to $7,500. The 2 that are asterisk at the $2,500 deductible, I do want to point out those are non-embedded deductibles, meaning if the employee or yourself does have that plan with family coverage, the family deductible must be met before the plan will start paying at the full benefits. Some additional benefits that we included when we were establishing this group for our WDA members is the plan selection. A lot of carriers will limit you if you don't have a certain number of members within your enrollment to 1 or 2 types of plans that you can choose. As long as you have the employees and that there's a head count in each plan that's offered, you can offer up to 4 different plans within one carrier. Now that's either 4 plans in WPS Health Insurance or 4 plans in WPS Health Plans. We can't intermingle those 2. So it really gives more flexibility for your employees when they are looking for coverage for themselves and their family. Sometimes people don't like or can't afford to have a payment for a service right up front, like an HSA plan or a high deductible health plan. So the copay plans are actually very nice for that because they do have that set amount. So you know exactly what you're going to pay when you go into your primary care provider. Employer contributions. Now we wanted to make sure that our employers that we're going to be insuring have the ability to offer anywhere from 0 to 100% of the employer paid premium for the employees. A lot of smaller businesses do a stipend, which you can certainly do as well. So you can indicate I'm going to provide $200 or $250 or whatever the amount may be per month per employee who's ever on the healthcare. This is allowable underneath the association plan. So it gives the employers more freedom. We do suggest at least 50% for the single premium. Because we're adding this as a benefit, we want to make sure that our employees feel the value from the plan. But we do have a lot of employers who offer the plan, and the employees do have to pay 100% of their premium. A lot of times it can be less of a premium than the Affordable Care Act, either on group or on an individual plan. What's nice with the rates is it's composite rated. So we take a blended rate of all of the people on the census in order to come up with that composite rate. So who really benefits from this are the individuals who normally would be age rated and have a much higher rate because of their age. If they're a single employee and based on the census information and underwriting, all employees will have one set premium for a single employee or a limited family or for a full family. Again, what's nice with that too is you can have 1 or 10 children and you're still a full family if there's 2 parental units. We don't charge, or WPS does not charge per child. Full-time employees, we realize that in a lot of dental practices, you may have hygienists who work in one office and then they go to another office where that 30-hour requirement, like ACA plans, just can't be met. They're just, a lot of times they fall just under that amount and then they're not considered full-time. We reduced the full-time hours to 26 hours for the association health plan. So you are able to offer full-time coverage to someone who works 26 hours or more. If your employee handbook says that your full-time hour requirements are 30 plus hours, that will totally supersede what we say. But definitely keep in mind that 26 hours is considered full-time. Now, if you do not have a employee handbook, we do offer a complimentary service, human resource service with our program as well, which is called Mineral. And Mineral is a human resource platform that you can actually go on to get a lot of answers to certain questions that might arise on the day-to-day basis, different scenarios that you're not quite sure how to handle. They will definitely take that into consideration and provide you some assistance and guidance as well. But definitely look on that website for any type of handbook information, because they do have that on there as well. Customer resources. WPS has an extensive online tool and resource library for our members and our employers. So once you do become a insured through WPS, I encourage each and every one of you to go online, register as a member or get your employer access. There is a ton of information on this website about health and wellness. There's a symptom tracker, so you can put in whatever type of symptoms you may have, and it almost like a MedMD, but I don't really like to look at those because I end up with some kind of crazy condition that I never heard of. But at least this will help guide you with different scenarios that you might be having. Just tons of information. I haven't seen all of the information because there's so much. Another benefit, because this is considered large group, underneath the WDA umbrella, WPS does have a $0 copay on select preventative drugs that helps maintain chronic conditions more effectively. We do have a comprehensive list of common medications that are used to treat asthma, depression, diabetes, high cholesterol, high blood pressure. And these prescriptions are generic and brand names. So a lot of times, if you're on something that's on this list, you're going to be paying no money whatsoever out of pocket to have these prescriptions. But we do have a list, and if you would like that, we can certainly forward that to you as well. Now, preventative services, WPS actually will pay 100% of your preventative services as long as you are in network. And I stress in network because with the two different options of the statewide or the select network, you want to make sure what network you're in before you schedule that preventative screening. Because if you're in a WPS health plan with a select network and you go to an Ascension provider, it's not going to be covered because they're not in network. So that's very key. But it does cover the routine immunizations, the routine medical exams, including diagnostic services, child care, mammograms, and your preventative screenings. So this enables you to actually go to the doctor once a year, get your preventative screenings to make sure that you are on top of whatever condition you may have or may not have, and be able to prevent something more serious happening for you. I had mentioned the no cost added values. Now, telehealth services from Teladoc is huge. And I don't think people really take advantage of the Teladoc services like they should. The services include general medicine, mental health, which is huge today in today's world, and dermatology. Your general medicine will actually have a $10 copay on the traditional copay plans or $55 charge on the HSA plans or HDHP plans. You can speak to a U.S. board certified doctor for non-emergency conditions 24/7 anywhere you are. So if you're on vacation and your child has an ear infection, a sore throat, don't run to the doctor for them right away. Call Teladoc. You can have an online appointment. You can talk to them on the phone. You can pull them up on your computer. They can say, open your mouth, say ah, and they'll take a look and see what conditions might be. They can detect bronchitis, flu, sinus infections, sore throats, rashes, and more. What's nice with that also is they can call in a prescription to the nearest pharmacy, and that way you can be on your way, still continue your vacation, or whatever you may be doing, or maybe you just don't feel good and you just don't want to get out of bed, and that's the last place you want to go is to the doctor's office where everyone else is sick. So give them a call. They'll call you back and take care of you, definitely, while you're eating your chicken soup and tea. Mental health care is also a $10 copay or a $90 therapist visit on the HDHP plan. They do have a $10 copay or $220 psychiatrist initial appointment. And then for ongoing appointments, it would be a $10 copay or $100 for the HDHP. You can talk to a therapist or psychiatrist 7 days a week. Now, they do have specific times for this one, which is 7 a.m. to 9 p.m. From wherever you are. So if you're having a meltdown, you're having anxiety, you're having stress, you're just not feeling yourself, you have depression, maybe you have some marital issues, and you don't want to talk to anybody that you know, and you want an unbiased opinion, definitely take advantage of the telehealth services. It's a very underrated service that we have. Dermatology, again, a $10 copay or an $85 online review charge on the HDHP. You can upload an image of your skin issues and get custom treatment plan within 2 days. So you suffer from acne, psoriasis, eczema, skin infections, definitely take advantage. This is something that was brought in with the mental health. I believe it was last year. So they're recognizing that there is more of a concern for these type of services and addressing it. We do have an iMed Vision discount. I certainly take advantage of this by all means. The provider network is pretty large. It includes Lens Crafters, Pearl Vision, Target Optical, and more. I go to Wisconsin Vision, then they're in there as well. America's Best, just off the top of my head. It does provide discounts for your routine eye exams, glasses, and laser vision correction. Hearing Care Solutions used to be called Hear in America, and they did recently change their name. This is a hearing program that's included as well, that includes one comprehensive hearing exam per year. You can get fitted for your hearing aid. There's discounted prices on hearing aids from 9 major manufacturers. There's a 3-year warranty plus a 3-year supply of batteries for non-rechargeable devices. Another couple new programs that they added in within the last year is the Pulmonary Care Program, Propeller. This program is to help manage asthma and COPD. It includes a sensor for your inhaler and a mobile app. So with these things, you can verify proper inhaler use, track usage, identify trends, and provide tips, or they can provide tips for better breathing. Because obviously if you have asthma or COPD, that's the last thing that you want to worry about. It encouraged compliance with reminders to take your medication on time, provides monthly and weekly summary reports to share with your treating physician. And God forbid you lose your inhaler. It can actually locate your inhaler as well. Nothing like having a breathing issue and not being able to find something that you need. The Diabetes Care Program through WellDoc is a personalized care management program for diabetics. It includes a mobile app also, and this will act as a personal diabetes coach. It will connect with fitness trackers and blood glucose meters. It will provide individual real-time feedback and suggestions, encourage compliance, again, with the medication reminders. I know we all get busy during the day and running from patient to patient, and pretty soon we realize, oh my gosh, I didn't take my medication. I don't know how many times I came into the office. I carry some with me now because I know darn well that I'm going to forget one day, and that way at least I know to take it. With this, you get the reminders, so you don't have to worry about it. And it does connect data for food, weight, activity, blood pressure, sleep, and more. So it's almost like your own little personal consultant. And another one, which is a great add-on, is the Tobacco Cessation Assistance. This is for members who are 18 years or older, up to 180 days assistance annually. It includes tobacco cessation office visit, which is required, so they can assess the situation. You have 1 nicotine replacement, such as the over-the-counter patch, gum, lozenges, prescription inhaler, or a nasal spray. And I'm going to massacre this name, I know for sure. 1 non-nicotine replacement, such as bupropion, sorry, HCI, Chantix, or Nicotrel. That's why I'm not a doctor. I can't pronounce these names. But what a great way to encourage your employees or yourself to quit smoking and really get into a healthy lifestyle. And it's at no cost to you. This is something that's included. Now, talking about our exercising, exercise rewards program is something that WPS has to encourage you to really take advantage of your gym membership. If you work out at a qualified fitness center 10 times or more a month, you will get a $30 fitness reward via check. Now, you do have to track your visits, and there's a few ways to do that. You can use the ASH Connect mobile app. You can do a paper log that you can either mail in or email to WPS. And then there's also the fitness centers can auto track if you're enrolled in the Active and Fit program. The Active and Fit program is a membership discount that has over 12,000 standard centers and 5,200 premium fitness centers within their program. It's a $25 fitness center fee. Premium centers are actually at a buy-up cost. And then if you move from one center to another and they're both participating, all your information does transfer from one participating facility to another. So nice job. Now you ask, how do I get quotes for this said association health plan? Very easy. We have a census form that we can email to you. You can go to our website, or you can contact us via email, and the information will be on our last slide. So take note of that. When you are completing your census, I want to bring to your attention that the composite rates that I talked about earlier will be determined on your census information. So if there are changes within your census, your preliminary rates will change. So when you're completing that, if you know for certain that all of these 10 people or 5 people or 2 people are going to take the plan, list them. If you have some individuals that are kind of on the fence and you're not quite sure, you can list them also. We can run a plan or a quote with the original people and then add in the additional people, so you can see what those preliminary rates are and how they change. I want to make sure that we give you the most accurate information up front, so there's no surprises when you get the preliminary rates that have been updated 4 or 5 times, and it just gets very confusing. So once you have your preliminary rates from us, we will also send over the employee application. That would need to be completed along with and sent back to us with any waivers. The UC 101, which is your state quarterly wage and tax, that lists out your employees. And if you do currently have coverage, we do ask, or group coverage, employer sponsor coverage, we do ask that the most current bill be sent along as well. So in order to submit everything to underwriting, we need enrollment applications for those interested, waivers for those declining, the UC 101, what plan that you would like to go with, or plans, because we can request multiples, and then your most current carrier billing. Once we have all of that information, we'll submit it to underwriting, and underwriting will do their final review of all of the information submitted. We do ask that you put all of your pre-existing conditions on the application, and then once they are completed with their final review, they will send us the final rates. Now, final rates, once we get those, Wendy and myself will send those along for your review, along with an employer group application. We'll set up time that we can talk about the rates, talk about the plans, who's taking what plan. Because again, remember, you can select up to 4 different plans within your group. So maybe Susie over here wants a copay plan. I want to say Dr. Smith over here wants a high deductible health plan. And then we can do that. That's no problem. Any new hires do not have to, after the plan has been established, any new hires that satisfy their probationary period do not have to complete the medical questions. I want to thank you for taking time out of your Friday to listen and get information on the association health plan. We encourage questions, most definitely, or if you would like to start the quoting process, you can reach us at info@profins.prog.com, our 800 number, or even our website. And we hope to hear back from you. Thank you.
Thanks so much, Chris, for giving us all this information on the WDA Association Health Plan. Does anybody have any questions? I don't see anything in the question area right now, but we'll take some time and wait and see if anybody has any questions on it. Chris, how long does it take from once they submit all of their information to you before you can give them preliminary rates? And then once that is, how long does it stay in the underwriting status?
Oh, that's a great question, Marilyn. Once we receive a completed census, Wendy and I can have your quotes out to you the same day, if not the next day. Very, very quick process for the preliminary rates. Underwriting, I want to say about a good week in order to get those final rates back. Of course, earlier the better to start the process, definitely, because it is fourth quarter. And as we all know, fourth quarter is an extremely busy time for underwriting with people coming in and getting new information established, but normally about a week or so for the final rates.
Okay, and any other questions coming in?
Now, with these plans, individuals say, okay, well, all of my employees have coverage through their spouses or another source. What about myself and my family? Can we get it if it's just us? We can do a group of one as long as we have a full-time waiver or declination from another employee. So we have established many groups of one underneath the association health plan that might just be the doctor, might just be the office manager, because maybe the doc is on another plan with their spouse or on Medicare. You can establish a group of one as long as we have, like I said, another full-time person declining or waiving coverage.
Okay, thanks, Chris.
Sure.
Any more questions? When a new employee is hired, must you offer health insurance to them?
Yes, actually, if they are considered full-time, according to your office handbook, you must offer the coverage to them. Now, it is up to them whether they take it or not. They can decline off of that coverage and stay on whatever coverage they are currently on, but it must be offered, and they must satisfy their probationary period that is set by the employer on the employer group application before they can come onto the plan. Probationary periods can be the first of the month following 30 days, the first of the month following 60 days, or the first day after 90 days of full-time employment. They do not have to do underwriting because it is already an established group, but they would have to submit their application the month prior to their probationary period ending. We want them to be a timely entrant, not a late entrant. A question came in that said, are the fees competitive with the market? Now, we, as a whole in the agency, we don't work on with any shop plans. So we don't work on the actual marketplace, but we do offer Affordable Care Act plans as well. And we have found that actually the preliminary rates in certain circumstances are actually coming in at better rates a lot of the times than the Affordable Care Act plans, especially if you have more mature employees. Because on the market or the ACA plans that are out there that anybody can get, we always call them, that's the street market, the street plans, where anybody can get enrolled in those. They are age rated. So if, like, again, if you have employees who are 40, 50, 60, who are still working, they're going to be age rated. Now, if you take those 3 employees on an association plan, we're going to combine and do a composite rate. So it's going to be one rate for all 3 of them if they're all single, which could potentially be a lot less than the association or the ACA plans that are out there. Do we provide any other benefits besides health insurance benefits? We sure do. Thank you for that question. I appreciate it. In the benefits area, we provide disability, long-term, short-term, life insurance, dental, vision, travel insurance, Medicare, prescription drug plans. In our personal lines, we have home and auto, renter's insurance. If you want to insure all those toys, Craig Thompson would be more than happy to take care of all of that. I know we have a few toys on there as well. And then we have a full service line with our property and casualty for all of your office needs. We have cyber insurance, ERISA, professional liability, just a number, office overhead. So we do have a number of different products out there to provide coverage in your business and your personal life.
So once someone, submits or starts talking to you, can they then right away put together a possibly whole group plan for them where they can include vision insurance, life insurance, so they can put a whole package together? You're able to help them with that?
Absolutely. Package deals are the best because you are actually providing the best overall package for your employees. We work with MGIS for our disability, and they do the short-term, long-term, and the life as well, kind of in a very nice package. We have diversified benefit services that can provide Section 125's premium only plans, HRAs, health reimbursement accounts, or HSAs, the health savings accounts, and much more.
Okay, we have another question come in. It's, do you provide health reimbursement account for individual, family, or does it have to be through a group?
That's a great question. Right now, we do it through the groups, through diversified benefits. I can certainly reach out and find out on the individual basis. I don't believe they do individual on the HRAs, but yes, the group most definitely. Most definitely. And I know that for 2023, the government did increase those limits on how much we can put into our FSAs as well, or HRAs as well.
Great questions coming in.
Absolutely.
On the plans that are the high deductible health plans, are they able to set up an HSA with you, or how does the HSA get, if they want a HSA reimbursement plan, how do they set that up?
Yep. We can set it up on a group basis through Diversified Benefit Services, or you can set, the insured can set it up through their local financial institution if they deal with the HSAs. I always say shop around if you're going to go individual, because you want to make sure about interest rates, what the minimum deposits are, what kind of stipulations or guidelines that they do have for them. But yes, Diversified Benefits does a wonderful job with the HSAs as well.
If we take out employee benefits, are we required to pay for them?
Again, with being an employer, if you take out the association health plan, you do not have to contribute to your employee's premium. It could be from 0 to 100%. It could be a stipend of a certain amount. Again, we always suggest 50%. On the disability and life products, we can do that contributory or non-contributory. So you could have a voluntary program with the disability and life. They do require, I believe they do require 100% participation if it's contributory. But yeah, if you're interested, we can send you the census, because it does have a little bit more information than just the health census, because we do have to have salaries and job titles. But we're more than happy to get that information over, and then over to our partner at MGIS.
Okay, thanks, Chris. Any more questions?
These are great questions, definitely. Thank you so much.
Well, if you have any questions, the information to reach out to us is right on the screen. You can email us, you can call us, you can go to our website, request information online, and all the information will be sent to the benefits team, and either Chris or Wendy will get back to you. So I just want to thank you again for joining us today, and have a great Friday and a fantastic weekend. Thank you.
Thank you, everybody.